Greetings and welcome to Decoding the Sanford Guide. I'm Patsy Thompson-Leavitt. I'm a nurse practitioner and professor of nursing at the University of Southern Maine. You don't really need a decoder ring to decode the Sanford Guide, but students often find this very helpful therapy guide a bit confusing, so I thought I would create this short video. Today I'm only going to be dealing with the paper version of the guide, as the online version is fairly intuitive. Of course, we have looked at the table of contents, and before we get started with looking at the book and trying to figure out what we are going to do for our patient, we take a quick look at the table of abbreviations on page 2. You might want to actually tab this page, as it is often something I have to go back to and look at the various abbreviations for the drugs mentioned in the guide. We start at the very end, actually, looking in the index, and we can do that either by body part, and we're going to focus on ear infections today. So we find that ear infections are noted here, and you'll notice that some of the pagination is in dark or heavy font, and some of it's in lighter font. When we're looking for our therapy decisions, we usually go to the pages where the dark or bolded font is. We can also go by disease, and in this case, we look for otitis media or acute otitis media. And again, it directs us to pages 11 and 12. So we dig into the tables. Table 1 is basically our go-to table for this kind of decision making. It starts off to the left with the WHO, and that, of course, is either the body part or the disease for which we are seeking treatment. The what are the etiologies, and of course these are the usual suspects, if you will, or those etiologies that we suspect in most cases, since of course we generally do not take a culture in a primary care setting, especially for things like otitis media, and we treat empirically. So you can see in this column that there are a number of pathogens which are responsible for otitis media, and in many cases there are viruses or a mixture of viruses of bacteria or bacteria. In terms of the bacteria involved, there are many types as well, but generally speaking, over time, science has found that strep pneumoniae is one of the most prevalent. In the third column, we see the suggested regimens, and you will see that this column is then subdivided into primary regimens or alternative regimens. In some cases, there is no separation of the columns because the recommendations are basically pretty straightforward, and there are no alternatives. So in this case, we're going to look at the acute otitis media in this case. And we are looking at all of these little notes about the age of the child. We're going to look in and see that here it says, okay, if there have been no antibiotics in the prior month, we want to go with amox-POHD. So what does that mean? Well, there's a note down below. Amoxicillin is dosed either as UD, usual dose, or high dose. And then there are other notations for some of the other regimens. Further down at the very bottom of the table, we will see, as we open up the page, that the drugs are then outlined in terms of their actual dosage. And this is where we're going to get our guidance in terms of writing a prescription or ordering the prescription through the electronic medical record. So in this case, if we are going to do amoxicillin high dose, we are going to prescribe the drug as 90 milligrams per kilogram per day, divided every 12 hours or every 8 hours. Lots of words just abbreviated very cryptically. Thus, my recommendation that you understand the table at the very beginning of the book, where there are abbreviations for the terms that now are considered not as helpful because they can lend to errors, those terms such as QD, BID, TID, and QID. But in a book like this, you are going to need to know those terms so that you understand how frequently the dose needs to be given. And in this case, they've given us our recommendations, so it's a lot easier. So every 12 to 8 or 8 hours. We can dig a little deeper and go into Table 4 if we want to understand a little bit more about the science, or in the case of situations where we really need to look at alternative therapy for some reason or another, perhaps multiple allergies or cost of drug. And in this case, we look at this table to see which of the organisms might be most susceptible to certain drugs within the drug categories. So this table has tons of information. At the very top, of course, we see a key, which helps us understand, in this case, this version has color coding, and that there are bright blue boxes indicate with the 2 pluses are the recommended therapies. And then it works our way down to the red or 0, not recommended drugs. They do make a note here that I think is very important, even for those of us in community practice, in that there are community resistance patterns which have developed because of our overuse of antibiotics, and thus some antibiotics which really should provide treatment and that the organism should be susceptible to are no longer useful because of the resistance that has been developed. But these are, again, these are guides to start with. So here we see our good old Strep pneumoniae again, the causative organisms for so many otitis media infections. And in this case, no surprise, the penicillins kind of win the day. And then there are certain drugs that we absolutely aren't going to bother with. And then there are drugs in some of the classes that may work fairly well, but within that class, for instance, the fluoroquinolones, ciprofloxacin, not a great choice for respiratory infections, but levofloxacin might be a choice. On this page, we have the parenteral cephalosporins. A later page has the orals. Of course, in primary care, we wouldn't have much to do with those except for perhaps some ceftriaxone, IM. But of course, great for hospital settings as well for teasing out IV antibiotic choices. I want to thank you for listening to this brief video. And again, I would like to thank my graduate assistant, David Wright, in the University of Southern Maine's Graduate Assistant Program. I thank the publishers of the Sanford Guide who provided a desk copy for this production. This slide set is the property of the University of Southern Maine.